I'm Nancy Hartshorne. I am a professor at a community college here in the US. I live in Michigan and I teach psychology. My link with Charge syndrome is the fact that I have a son who's 30 years old who has Charge syndrome. My training and background is in school psychology and assessment of individuals with disabilities. When my son was born, Charge syndrome had just only been identified as a syndrome. It was not well known. There were maybe 2 articles about it in the literature, and they were each case studies of children who had died and had been diagnosed afterwards. So there was no information out there. And all we knew was we had this diagnosis. We also had no internet yet at that time. And we were writing letters to other families. I think I knew 4 other families with children with Charge across the United States that I wrote letters with. So I had trained as a school psychologist prior to having Jacob. And so I knew a little bit about disabilities, but what I learned from having him has driven my career all the way through for the last 30 years. In a normal, typical setting, traditional assessment for infants, children, and even adults with disabilities typically consists of standardized tests, and these tests have been used for thousands and thousands of people. And so we get these average scores that then we compare the person to that we're on whom we're doing the assessment. So a lot of times this includes an IQ test, an achievement test, some other kinds of tests that have these standard scores. When you think about standard scores and standardized assessment, they're based on the test scores of people without disabilities. So we're looking at an IQ test that has been given to 10,000 people, and average scores have been calculated. Scores for cognitive impairment have been calculated. Scores for those who may have a gifted or genius level intelligence have been calculated. But none of the people on whom the test was standardized had any kind of disability, typically, especially not deafness, blindness, balance disorders, any of the things that our children with Charge syndrome have. And so they're really not appropriate to use. We can use them to try to find out some strengths and needs of the people, but it's not appropriate to use the scores because the scores are not valid for this population. So we need to come up with some other way to do assessment of the needs and strengths of people with Charge syndrome. Assessments can be used at any time of transition and in terms of trying to define eligibility for a person for services. In the US, we're often looking at eligibility. Does this person qualify for the funding for special education? Does this person have a need for nursing services or to have a person in their home living with them? We're often looking at what are the person's needs and how can we help them? And the assessment helps us determine that. So this can happen at infancy, this can happen at school age to find out what kinds of educational needs the person has. This can happen at transition time into adulthood to find out what kinds of work the person enjoys, what kinds of skills they have for living alone, and how to plan programs. So basically, assessment is supposed to have a question behind it, and you plan the assessment based on the question you want answered. So if the question you want answered is, what should my child or what should my student be doing once they graduate from school, then you would design the assessment to figure that out. And then the assessment is supposed to give you results from which you can then plan. A score in and of itself doesn't give you those kinds of results. A score can give you eligibility or can tell you a little bit about the person's cognitive ability or their ability in math or reading, but it doesn't really give you rich information in terms of what to do next to help this person. In a traditional assessment, you typically see, as I was saying before, standardized tests. The team members tend to split up which tests will be given. So each team member, depending on their area of expertise, will use a different assessment instrument. So you may have the physio assessing the physiological functioning of the person, the psychologist assessing the cognitive function. You may have an occupational therapist assessing fine motor skills. A speech and language therapist may be assessing communication. You may have someone else assessing social needs. So everyone kind of does their own separate thing. And in the US, what typically happens is everyone comes together in a meeting at the end of the assessment and discusses all of their results together with the family to then go and make a plan. So the plan then comes to coming up with goals and objectives for the person to then try and move toward for the next period of time. In my experience, a traditional assessment doesn't always involve a lot of parent input, but sometimes that is because of time constraints. So for instance, my first year as a school psychologist, because we have a law here in the US that says every child must be evaluated every 3 years, and psychology services are expensive, I was given 100 assessments to do in a school year. And when I started my job, I was 30 cases behind, and it was impossible to ever catch up. And so it was often send a letter to the parents. We didn't have email then yet. Send a letter to the parents asking for their input, or phone them and ask for their input over the phone, do the assessment, write the report, go to the meeting and read the results. If things were perfect, we would be able to spend about a week with each child and their family and their teachers and their therapists and do really clear planning and be able to come up with much better results and much better ideas for moving forward. But assessment has become this sort of check off the boxes sort of system where people just want to get the work done and move on to the next case. And so parents sometimes get left out of that, and that's not good practice. We need to do some different things for children with charge syndrome, and that is because they have multisensory impairments. So for example, you really cannot use standardized assessments with them. We need to come up with new ways to do assessments of their needs because they have communication difficulty often. Many of them have a lot of medical difficulties. The balance disorder can be a real problem. They need to be able to stabilize their head in order to see and for their eyes to work correctly. And so not only do we need to have assessment plans, ideas, and instruments that will work for these children, we also need to understand charge syndrome and understand the individual child's needs before going into any kind of assessment. So part of the assessment itself is understanding the child and who they are and where they're coming from the beginning. So just observation is a huge, huge part of this. Observation, speculation, coming up with ideas, consulting with the professionals who know the child, spend a lot of time with the family, understand the behavior of the child before you can really carry out any kind of real formal assessment. So it's very important to not only just include the family in the assessment, but have the family help drive the assessment. Parents know their children best and have a wealth of information about their child's background, health-wise and educationally. And if they're left out of the assessment, you're missing a large piece. And so having the family be a huge part of it and take part in the actual of the answering the questions and what they want for their child and what they think their child needs is so important. And it gets them on board, and the whole team can then work together and respect the fact that this family has a life outside of school or outside of the programming that the assessor is involved in, and see the whole picture, see the whole child. From an adult perspective, when you're doing assessment, if the person is able to clearly, or not even clearly, to make their needs known, helping them to drive the assessment themselves, making it person-centered, making it about them is the most important thing. Respecting them, respecting their needs, respecting their dreams. One of the ways of doing this is by using a person-centered planning method, and that is a way of bringing people together around a person, people who care about the person, professionals and personal contacts and family, and having everyone there to help support the person to talk about their own dreams and needs and wishes for their lives and base the planning on that. It's a very rich way to do planning and assessment that gets away from scoring and giving the person tests and having them try to live up to a standard, and gets more at giving them the quality of life that they want and helping those around them to plan it for them, or to assist them in planning it for themselves. If you're working with an adult, or if you have an adult child with Charge syndrome who is less able to communicate those needs, like my son is, he has very limited communication abilities in terms of being able to talk about long-term things or the future or anything that's very complicated. That is when the family and those people who love the person the most would come together and do this person-centered planning assessment and meeting and come up with plans for the future for this person that in their mind, this person would want for themselves. Person-centered planning is a holistic approach. It brings people together. It looks at all of the person's needs in every way that you can think of a person's needs. And it's very positive. And so it's focusing on the positive and not the negative. Whereas sometimes we look at assessment and say, this person can't do this, or this person needs to learn this. In person-centered planning, we're looking at the person's strengths. What do they like? What do they want around them? Who are the people they'd like to have in their lives? What kind of work do they want to do? Where do they want to live? And instead of then saying, well, they can't do that because we try to find ways to support their dreams and their needs by building up the supports they do need. So people aren't cut out based on their eligibility or their skills, but they're a part of their community no matter what, with the supports built under them. So the people who come together for a person-centered plan are the people that the individual wants to be there. Anyone that they feel is part of their circle of support. So often it can be the parent, it can be family friends, it can be siblings, aunts and uncles, school providers, people from other agencies. And I've facilitated person-centered plans that had 20, 30 people around the table. I've also facilitated person-centered plans that just consisted of the person and their parent and myself. So depending on how large the circle of support is for that person and who that person wants at their meeting, that would be who it is. So you see, it's a very open-ended, holistic plan. There's no right or wrong way to do it. Although I've also been at person-centered plans where a person has told me, the individual has told me, they do not want a particular person to be there. For instance, their guardian or a teacher they don't get along with or someone they work with. So, and then the person may show up at the plan and you have to turn them away because the individual does not want them there. They don't feel supported by them. And you want them to be in a place where they feel the love and support that they think they need in order to move their life forward.